Thank you very much. It's a great pleasure to join you all. I'm going to speak quickly because I have to. I'm going to talk about how science has informed disaster response, how it helps us. For those of you that turn on the TV and wonder, gosh, it seems like something's always happening. It must be that disasters are getting worse. You reassure yourself, no, it's just the CNN effect. They're just televising them more. The bad news is, yes, there are more disasters. And the reasons are multifactorial. Climate change certainly plays a role, but the human impact of disaster is also increasing. People are increasingly living in urban areas, meaning when a disaster happens, we're all closer together, there are more of us together, so the impact is bigger. We're in coastal areas, so flooding impacts us more, weather storms impact us more, so there are more disasters and they're having more of a human impact, unfortunately. But the good news is we have tried and true mechanisms, which include the disaster cycle, for how we prepare. We mitigate, we try and hurricane-proof our houses, we lift them up on stilts, we change our windows, we do things to limit the impact of a disaster. We plan, we respond as well as we can, but we also practice when there aren't disasters, thankfully. We do have things we can do when we're not waiting for a disaster, meaning we go through simulated exercises, and then we try and recover. And we're making improvements in all of those areas. But what I really want to talk about is how we really are learning how to plan and prepare better for disaster. And this is an article from 2008 where a fellow from the Kennedy School talked about the marathon as a dry run for disaster. We are increasingly learning that what we need to do to really be ready for disaster is practice. We need to go through exercises. And exercises are expensive. When we do a full-scale exercise at Mass General, it probably costs us about $20,000. So we can't do them very often. But we also use the pre-planned events that we have as opportunities to test what we do. And we didn't just do it in 2008, which is the date of this article. We've been doing it since the 80s and the 90s. And we didn't, thankfully, have anything happen in 2008, not in 2009, but of course, tragically, we did in 2013. And the science that we have been applying for the last decade and more to disaster preparedness says that this is what really matters. It's planning, it's testing, it's going through the motions together to learn what works and what doesn't work. And it's only because we've been doing this for so many years that we had a chance to make a whole bunch of mistakes in how we communicate, how we triage, how we share patients among the hospitals. And so when very unfortunately we needed to respond last year, we were able to do so because we learned what works and what doesn't work. What didn't work was teaching people the plan once, putting it away, never having them try it again. What does work is practice, 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 practice. And so, in addition to the fact that that works for us, I want you to hopefully take this message home to yourselves. It's easy to think that there are disaster professionals planning for the city, planning for the state, planning for the country, working hard, trying to make you safer, trying to make you better, and that is absolutely true. There's an amazing community across this entire country of people who are studying disasters, learning how they really happen. I will tell you that when I started in disaster response in the 1980s, I learned how we would like a disaster to happen. It never worked that way, and we thought we weren't very, we just didn't apply the plan the right way. We now study disasters and learn how they really do happen, and again, tragically, that actually was a lesson we needed to put into place last year. But this is true for you too, and you need to go home and you need to be prepared. We saw dramatic differences in communities in the Gulf Coast and in the greater New York area after disaster because the differences in community resilience, in personal preparedness, that people had different plans, different resources, different ability to respond. And so this is the time now when there isn't a disaster that you should be doing these three things that the slide says. Be informed, make a plan, build a kit. Be informed. Know where you're going to get your information when disaster is coming. Twitter's good, but it's not always accurate. Know where you're going to get accurate, reliable information about the hazard, about what you need to do. Make a plan. If you're not all together as a family when a disaster happens, know how you're going to get together. Know how you're going to reach one another. Know what you're going to do if the roads are out, if there's power out. And build a kit. Have some resilience. Have a limited amount of food, water, your medications. There's not that much that you have to do. This is a screenshot from ready.gov. Free resource, go to ready.gov. Plan for yourself, plan for your family, so that if, God forbid, something happens in the Boston area, you are ready, you're resilient, you don't need our help because you've planned so much. The science of disaster says that people who are resilient, who've prepared ahead of time, will actually get through a disaster much, much better than those who didn't. So know that there is actually data behind preparedness, and you need to prepare. It's so close.
Come back. Oh, come back.
I get 5 more minutes.
So, thank you for being such a good sport about the time. Now, we have 2 mics, one either side. If you want to ask a question, they should be brief, and they should end with a question mark. Then please come up to one or other of the microphones. While you're getting your questions ready for Paul, I have one, which is, okay, so you had practiced and you rolled out what everybody I know regarded as an incredible effort last year. Did you learn any lessons from that, though, which changed or even yet improved your preparedness next time around?
We did learn some lessons, absolutely. I think one of the big lessons that we learned was that our hospital community is much bigger than the community we think of. So at Mass General, I have 26,000 employees. We did a great job of letting the 150 leaders within the institution know and talking to the emergency department folks, the ORs, the ICUs. But the whole community wants to help. And what we weren't able to do was talk to all 26,000 of them of how they could help, what they should do. And so, just like a broad community across the city, across the state, people want to be informed. They want to know what they should do if they can help. We didn't do as good a job inside the hospital community of telling our own employees of that. We now have a messaging system. We can tell them. We can share information. One of the great fears I have is things worked in our favor that day as well. It was a daytime. It was a change of shift event. The bombs tragically blew up right at change of shift, so I had double the number of staff. If something had happened, not during the daytime, not at change of shift, in the evening at a holiday, sometime when we didn't have nearly the personnel resources that we did, that's what we're trying to learn for lessons, make sure we can communicate, muster our resources as best we can.
Okay, thank you. The mics over here. If you want to ask a question, you need to get to a mic because you won't be heard otherwise. Don't worry about moving around while answers are coming, because every second counts. So yes, you can run, don't trip. Don't trip. Please.
For example, just a few days ago, Korean ship sunk, and many students, basically, unfortunately, we don't know what happened to them. So my question is, when so many people are in chaos, how do you get prepared? If even individuals get prepared, but when they're in a group, how can they prepare?
It's a great question. The principle that we have is called all hazards planning. So I will tell you that 80%, give or take, of what I need to respond to disaster is the same whether it's a marathon bombing or a hurricane or a snowstorm or H1N1. It's command and control, coordination, sharing of information, something called situational awareness. That's how we impose order on the chaos. So we use a streamlined organization system. We have special ways we communicate information very quickly, and it's through that common emergency operations plan, all hazards preparedness, we use the same plan, which we did, by the way, in H1N1, the marathon bombings, the 4-foot snowstorm, all of those things, we respond the same way as a hospital. Yes, please.
Thank you. Please, over here.
My daughter lives in the Bay Area on the West Coast, and in visiting her over the years, I see all the public awareness messages about preparing a kit, and you have to take care of yourself. I think they're promoting for 72 hours. How should you design your kit in this area? How long should we sustain ourselves before help comes?
So I'm not trying to turn everyone, thankfully, into doomsday preppers, but I do think that realistically, 3 to 5 days, as much as you can afford, as much space as you have, is the right answer. Most of you may know that in a just-in-time economy, which is what we have, no one really has a warehouse of anything. Studies show that a grocery store will be empty of its supplies if it's not resupplied within 3 days, and that's not without a panic and a run on supplies, as maybe many of you remember from the water shortage a couple of years ago. So 3 to 5 days is what it takes to resupply. That's the right number.
Thank you. Over here.
Most of us are so dependent on cellular communications. What should we do if cellular communications are down?
Text messaging sometimes works when cellular doesn't. Long distance numbers often work when local numbers, long distance numbers work when local numbers don't. So those are very common messages. And then finding a good old fashioned landline really does help. I would encourage you to have a phone at home that doesn't plug into an electric wall.
Right, thank you. And one here.
What if the disaster isn't like a snowstorm or a terrorist attack or anything in the real world? It's like a shutdown of all of our technology or some sort of electronic attack. It sounds like most of the preparedness relies on having that electronic infrastructure.
So I'm a professional Luddite. I really do. We prepare so hard for for loss of technology. And in fact, it's one of the most scary things we have in the healthcare community. We've become so dependent on technology. But runners, paper forms, good old-fashioned, handwritten technology, we actually have those systems if we lose all of our technology.
Okay, thank you all very much, and thank Paul.
Thank you very much.